From Rectangle Health, this is the Modern Practice Podcast. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast, brought to you by Rectangle Health. I'm your host, Gary Tiratsuyan, and today we're delving into a critical topic that sent shockwaves throughout the healthcare industry. As many of you are already aware, Change Healthcare recently fell victim to a cyber attack, disrupting processes for physicians and hospitals nationwide. From billing to prescription management, the repercussions of this attack have been felt far and wide, affecting countless providers, patients in an instant, really. Today, we unravel the implications of this event and explore its impact on the healthcare organizations and beyond. And joining us are two industry experts, Mike Peluso, Chief Product and Strategy Officer, and Brian Doyle, Senior Vice President of Enterprise Technology Partnerships at Rectangle Health. Mike, Brian, thanks for taking the time and welcome to the show.
Hey, Gary. Thanks for having us. It's great to be here.
Thanks a lot, Gary. We're excited.
As am I, and I want to dive right into it and get into the heart of the matter. Change Healthcare is a prominent player in the industry. But Mike, can you give us sort of a brief overview? Who are they? What do they do? Why does their recent cyber incident hold such significant impact on healthcare organizations and patients?
Yeah, Gary, thanks. As you said, prominent player in the healthcare industry, and they facilitate a large portion of healthcare transactions. And when we say healthcare transactions, think about eligibility transactions, checking if a patient has insurance, checking if a patient has benefits. Think about claim transactions. So when a provider, medical, dental facility wants to submit a claim to an insurance company, it's got to go through Change Healthcare, or more often it goes through Change Healthcare. Additionally, think of payments back from insurance companies. A lot of times those will flow through Change Healthcare as well. So they're a major software entity. They're a major clearinghouse entity. You'll hear us use that term a lot. And as you know, I love a good analogy. Think of them similar to an oil refinery, right? So if you think about how sort of an oil refinery takes oil, refines it, and then delivers it out to all the gas stations throughout the country. If you were to rewind back a few years and think about how there was an oil refinery outage, think of the broad implications of that, right? And a lot of people kind of go, I don't know, who cares? An oil refinery is out. But if you think about the implications that we all felt in that all of a sudden gas stations weren't getting gas, right? All of a sudden consumers weren't able to put gas in their car. All of a sudden people weren't able to go places, right? And that's a pretty big impact. So if you take that same impact and then apply it to something like pricing, because the supply of gas went way down, the price went way up as well. When you look at the Change Healthcare incident, sort of the broad implications are far-reaching, similar to that. And we'll go through some of that. I know you have a few questions around that, but if I could give everybody a really good analogy of how they impact, that would be a good way to sort of sum it up.
Yeah, I think that paints a great picture to visualize it, and it's evident that Change Healthcare's extensive presence made it a prime target for a cyber criminal. Brian, I'm going to turn to you now. The cyber attack on Change Healthcare has been described as one of the most substantial breaches in healthcare history. From your conversations with healthcare organizations, can you kind of elaborate on the specific ways that they were impacted by the attack?
Yeah, absolutely. What we've heard over and over again is shock waves, whatever you want to say about it. My discussions specifically with, your mid-market to up-market healthcare organizations, it became very, very apparent that this breach was multifaceted for their organization. The first and probably most important was the inability or the slowdown of their cash flow, right? When we, like Mike said, we think about billing, we think about claim processing. Many of these providers were unable to collect themselves for weeks. We actually talked to one organization who said they have $3 to $4 million a week tied up due to this breach. So when you think about the cash flow and what that means to run your business, it's critical. Then we started talking about some ancillary issues from this breach, right? We think about raised concerns about data security. In healthcare, you don't really think about that often. It's just kind of in the back of your head. But data security, patient privacy is all on the forefront right now in these organizations. What that led to is a lot of these organizations had to have a reality check. They haven't thought about these things in a long time. They kind of just, check, we're HIPAA compliant, move on. But now with this breach, that data security, cyber insurance is extremely important to not only know how you're set up, but how you're going to get out of a issue like this. So overall, we've heard a number of different things from our healthcare providers stemming from cash flow, cyber insurance, lack of compliance, lack of updates. So it's brought a lot to the surface throughout the market.
Thanks for that, Brian. And again, it speaks to the sophistication of the attack. And it's evident that many providers were left scrambling to cope with the fallout. As you mentioned, they've got cash locked up and not flowing freely. And it's really resorting to less efficient methods like paper submissions for claims processing. In light of this challenge, Mike, what advice would you offer a healthcare provider today to navigate around the obstacles, sort of deal with the situation now and kind of streamline that reimbursement process, even long term?
Yeah, Gary, great question. Kind of a big one. So I'll break it down. And the best word that I can utilize for providers and the best advice that I can give is risk mitigation. And that word has a lot of different meanings, but when I think about it, I'll break it down. And one of the biggest ones, and Brian just mentioned this, was payment risk. In order to operate a successful business, right, you need payments coming in on a consistent basis, right? Cash flow, right? And ideally, providers, they've always focused on that insurance cash flow, right? And that's kind of sort of the way it is in the U.S. healthcare system. Insurance carriers pay a lot of the claims, right? And as an industry, we've invested millions, billions, if not trillions, in getting paid from insurance companies. Right? And it was almost a foregone conclusion that insurance company payments would always flow until this incident with Change Healthcare. And all of a sudden, that consistent thing that always occurs suddenly stopped for everyone. It was almost, it was equivalent of a COVID moment. You never thought something like COVID would happen where, the world would shut down in a day. Well, imagine your cash flow shutting down in a day. And then that cash flow flows down, right? It flows down to the employees of that practice. If there's no dollars coming into that practice, guess what? There's no payroll either. So when you think about the risk mitigation, you have to think about that cash flow. And the other side of insurance payments is patient payments. And there's been a lack of investment around that in the industry, just because it hasn't had that sort of that highlight or that spotlight that insurance payments had. But if you can mitigate some of your insurance payment risk and turn it into, well, let me make sure I have patient payments flowing, right? If one stops, the other one comes in, and it goes both ways. If for some reason patient payments stop flowing one day, well, at least you got the insurance payments coming in. But this incident highlights what happens when insurance payments stop flowing, and the practices are kind of like a boat in the water without an engine. They're kind of just sitting there going, what do I do, right? Well, have a backup engine. Might not be as big as the normal engine. Remember, I love my analogies, Gary. Have a backup engine, and it's smaller, but it's there, and it'll get you to wherever you need to go for that time period. So that's probably the biggest one. The second sort of risk mitigation factor is don't put all your eggs in one basket. I think a lot of providers, they didn't know that they had that many eggs in the Change Healthcare basket. That they were that reliant on this one large vendor. But now sort of, this is why we're all here. We're sort of trying to respond to the incident. We're trying to go, well, how do you mitigate that? Take a look at your large vendors. Make sure, especially if you're a large organization, make sure you have backup plans to go, well, if this one goes down, I can switch to that one. If that one goes down, I can switch to that one. And this can go for any critical service in an office. It doesn't have to be just claim submission or eligibility. It can be payments. It can even be supply vendors. What if you bought all your gauze and rubber gloves from one vendor and that vendor went out of business tomorrow? You got to get gauze and rubber gloves from somewhere else. Again, giving you pretty extreme examples, but you don't want all your eggs in one basket. And I think this has definitely taught us that. The last one, and Brian touched upon it, and we'll touch upon it a lot, is, these words like HIPAA and PCI. Within these regulations, you as a medical provider, dental provider, hospital, any type of facility, there are sort of standards you're supposed to be meeting, from protecting your data, having, two-factor authentication for passwords, having data backups. These up until this incident, I think a lot of people looked at these as just sort of check boxes. Yeah, I got that. Or I have a document that says I have it. Have a document that says you have it, and actually having policies and procedures or technology in place to support it are two totally different things. So again, I would sum it up into those three sort of risk mitigating ideas or risk mitigating concepts. And now the sort of urgency is building around making sure you're going after at least those three. I'm sure there's more.
Yeah, makes total sense. And it's risk mitigation and business preparedness too. You just open up different avenues and different channels to collect revenue just to cover yourself. It all makes sense. And thanks for that insight. And it's crucial for providers to explore those avenues to recoup that lost revenue now. And Brian, I want to shift to you and shift focus slightly and talk about text to pay, bulk text to pay, keeping a card on file, and online payments offered by Bridge Payments. Within your engagements with these providers, and especially the larger healthcare organizations, do you sort of see the market adopting these type of payment solutions? And how does that sort of expediting patient payments correlate with bolstering a practice's financial stability in times like now, where we're dealing with this Change Healthcare attack?
Yeah, it's a great question, and it's a fascinating one that has a lot of ebbs and flows. But it's in the past, pre-COVID, let's say, things like text to pay, card on file were nice to haves. That's kind of cool. No one's going to use it. That was the overall trend in healthcare. Then COVID came, and all of a sudden, text to pay, card on file, the consumers, the patients said, this is the only way I'm going to pay now. I need to have this. That trend is still there. The consumerization, we like to say, of payments is real. I'll use an analogy, Mike. I like Open Table as an analogy. I don't call a restaurant, give my name, and then walk in and they pull out their book and find my reservation. No, I do it all on my phone. Then my card is already on file. I walk in, they sit me down. The consumers of healthcare want these technologies. Now, what we're seeing is a lot of the providers, I'm going to talk upmarket first, have a lot of these solutions in place. They're just not leveraging them because for whatever reason, they're concentrating elsewhere. So we have seen an uptick of usage or adoption across the board, specifically on text to pay and card on file. So card on file is mission critical to keep the cash flow coming in, because if we don't have insurance payments coming, we have to make sure and ensure we get paid from our patients. Card on file is the best way to do that with all the ancillary products like text to pay, payment plans for patients in need, etc. Now, what we're seeing even more is the individual provider level realizing, probably for the first time, that they absolutely need these softwares and these solutions. In the past, it was, my patients will pay me, no big deal. We'll get paid when we bill them. Well, billing is piling up. We don't have insurance payments coming in, or we didn't. So leveraging these payments is allowing the providers, like Mike said, to hit payroll, to continue to see their patients, to continue to provide healthcare which is what they're trying to do in the first place. So the overall adoption of these payments has absolutely improved or grown over the last 4 to 8 weeks. The expediting patient payment is not just about convenience any longer. It's about ensuring the financial resilience and sustainability of healthcare practices, particularly during challenging times like this.
Yeah, makes sense. And Mike, I want to turn to you and reference what Brian just spoke about, having this uptick in card on file usage, text to pay. Let's take it a step back and look at providers who don't have these features, this functionality, or these systems in place to collect these payments. During the time of when systems were down, what were sort of downstream effects to revenue? You touched on it a little bit earlier, but to the revenue, additionally, what's the impact of the cyber attack on patients during that same time frame?
Yeah, great question again, Gary. And it's not the easiest explanation, but let's walk each other through it and see how it goes. Yeah. Because it's complex, and I think that's why you don't see a lot of descriptions of it online, and why you don't really understand sort of the true impact. But if we were to think about the day that this incident happened, okay, that particular day, okay, providers were expecting payments from insurance companies. Okay, they immediately stopped on that given day. Okay, and most people would go, okay, that's bad, right? But then they stopped for the additional 2 to 3 weeks following that day. Okay, that's a little worse, right? But kind of people go, all right, well, after the 2 to 3 weeks, it's all back to normal. I think the piece that everyone is forgetting is during that 2 to 3 week period, you also couldn't submit a claim for payment either. Right? So not only are you not getting the money owed to you, but you can't put in any claims for additional money owed to you. So, and that impact will extend for a very long time, because 3 weeks later, when everything comes back online, well, then you have to put in the submission, and then the claims process, which can take, depending on payer, 30, 60, 90 days, then that kicks in. So if you were to think about this 3 week period, okay, it will create reimbursement issues for easily the next 90, 120 days. And a lot of these practices, to what Brian was saying, they don't have the resilience for that. They didn't build systems for that. They kind of like all of us assumed that the insurance payments would just keep flowing. Even the government has gone in and tried to figure out ways to give temporary loans. Even the vendors, Change Healthcare themselves, has tried to figure out a way to give temporary loans. Anything they can do to sort of help float that time period. But a lot of people look at incidents like this and they go, oh, it was just 10 days, right? Well, it's a lot bigger than just 10 days. So hopefully everybody understands that and has a better appreciation for it now. And the one other thing too is during that 10-day period, providers may not have been able to check eligibility for a patient. Now, some providers are okay with this, meaning you're coming in for services, you have a good relationship with your dentist. He's going to go, change is down, but you've been coming here for 5 years. We're going to go ahead and give you service. Yeah. But think about new patients or emergency patients. They couldn't validate whether they had benefits or not, right? And depending on, again, one of our comments from before, depending on whether or not they had the ability to take patient payments, they might not have had the ability to collect anything from this emergency case or this new case. And a lot of times providers will go, sorry, I can't help you. So that also occurred during that same time period. And that's an effect on the practice. And now we're starting to talk about effects on the patients. That definitely created some issues. And then the last one and the biggest one, and we don't dwell on this one a lot, but it is a big one. Change Healthcare most likely had a record for 70% of the United States population.
Wow.
That's how big and broadly reaching they are. Right now, that data is out there somewhere for someone to obtain. So I think you'll see in the next, and it'll take a little while to unravel all this, in the next year or so, almost all of us will get one of those letters that says your data's been breached by an incident. You're now offered free credit monitoring. I know there's some rules and regulations around that. I think everyone will start to see that very soon. I'm hoping patients in their brains don't link that back to their providers, because patients don't know who Change Healthcare is. They know who their provider is, right? I'm hoping patients in their brain don't go, oh man, Dr. Joe let all my data out there into the dark web.
Right.
How did that happen? I think we'll also have to do some good communication with patients to help them understand Dr. Joe didn't do anything wrong. Dr. Joe did everything he was supposed to do. Dr. Joe has the right cybersecurity policies in place, has the right HIPAA policies in place, has the right protections in place. This kind of just happens from a much bigger entity, just like you could blame the gas station for running out of gas, but it was really the oil refinery that went down. Right. It wasn't the gas station. So I think we'll have to navigate that in the coming months, and we'll certainly be able to help providers with that as well.
Thanks for that, Mike. And I think it's a perfect segue. Brian, I'm going to turn to you. We've spoken a lot about the revenue impact, keeping revenue flowing even when the insurance payments may be down or vice versa, and being prepared for that. To Mike's point, the risk mitigation. But I want to talk about true cybersecurity protection. How can a provider ensure that they're keeping that patient data safe?
Yeah, so like Mike said, let's make sure we do have the proper HIPAA certifications and proper cybersecurity insurances, and let's make sure we're buttoning up what we need to button up. Like we kind of talked about, a lot of the individual clinics think, yeah, I have a HIPAA binder somewhere, I'm good. Right. Well, the reality is you have to go through an annual HIPAA assessment, every single year. You have to do it. Now, if call us, we'll help you out. We'll actually provide it for you. We'll take care of you. We want this to get done. But you have to make sure we're going through this process. We need a software or a solution in place that has data backed up, that encrypts our emails, that does have cyber insurance. So heaven forbid anything ever did happen, we're protected. So our bridge compliance product is specifically built, especially for healthcare providers, to maintain an effective and scalable HIPAA, OSHA, and cybersecurity protections. So what we want to do at Rectangle Health is provide this for as many people as we possibly can, as fast as we can. We could have this up and running for you. So if you're listening to this, we can have this up and running to you in about a week. So give us a call. Let's go through it. Let's make sure everyone's protected.
Thanks for that, Brian. And the attack on Change was attributed or taken credit by one of the world's largest ransomware groups, highlighting their persistency, their sophistication, and we all know patient data is incredibly valuable. So there's the reason why for the attack, and Change's reach obviously drew these criminals to them specifically. And I think one of the most concerning aspects is the uncertainty surrounding whether the criminals will release this sensitive patient data or even after a ransom is paid. And with that in mind, what kind of proactive measures can providers take to sort of minimize that risk of falling victim to a ransomware attack? And if there's an unfortunate event that they do become victims, what steps should a provider take immediately? We've touched on the aftermath of the attack, but do you see a sense of heightened apprehension within the industry following the incident? And I'll turn to both of you. Mike, we'll start with you.
Yeah, Gary, I think the best thing I can say is if it can happen to Change Healthcare, it can happen to you.
Right.
I mean, Change Healthcare is a huge corporation. You know, they probably have 200 cybersecurity or security analysts on staff there, and it still happened to them. So you as a provider are by no means excused from being a victim. So you have to be proactive about that. You have to be vigilant about that. The other thing that providers don't get the luxury of, and luxury is not the right word for it, but Change Healthcare just shut down operations for 3 weeks. Basically, they locked all the doors. and they went into sort of an incident response mode of, we're going to get this fixed and we're going to untangle everything. As a provider, you actually have to go into the same incident response mode, but you can't lock the door. Okay, you're a provider of critical services for patients. People are going to want to come in the next day for their appointment still. Okay, people are going to need that, emergency dental treatment, or that, broken tooth fixed, or, most people don't want to miss their appointment with their cardiologist, right?
Right.
So if you're in a situation where it happens to you as a provider, it's actually more critical for you than it is for somebody like a change, because patients are going to come in the next day, and they're not going to want to hear that you had a cyber incident, and they can't get their medical problem worked on. And we could go pretty extreme, but some of these are life-saving treatments. I'm pretty sure, a cancer patient's not going to want to hear they can't get their cancer treatment because there was a cyber incident. So I don't mean to be so severe in my example, but I want to let providers know, I want to let your listeners know that it's almost more critical for you to be more vigilant and more responsive to these types of things than it was for change. And take it as a learning lesson. If it can happen to change, it can happen to you. And you need to have the right policies in place. You need to have the right systems in place. You need to have the right data backups in place. You need to have the right sort of secondary systems or backup systems in place so that something does go wrong. And it is even more critical for you as a medical dental provider to have those than it is for someone of the scale of Change Healthcare. So hopefully as providers that you hear this, you kind of go, I really ought to make sure that this doesn't happen to my location. Right. And sometimes it's hard to avoid. It's gonna happen, or it might happen. Maybe that's the right word. What do you do when it does happen? What's the plan? How do you get the data back? Do you have the cyber insurance in place to make sure your business stays afloat? Can you open the very next day, or can you almost continue business operations without anything negative happening to the patient? Obviously, it's going to be a little chaotic for the organization, but again, you want to be able to continue to service patients regardless of said incident. And you got to have a lot of policies, procedures, and systems in place, similar to some of the ones Brian talked about, to make sure that business continuity continues.
Yeah, that makes sense. Brian, anything from your end?
I mean, Mike nailed it. It's 100% right. At the provider level, if we pushed it off or we haven't gotten our assessments this year, let's make sure we do it. Again, if it can happen to Change, my goodness gracious, it could happen to us. So Mike nailed it, so I'll just move on. But the short answer is yes.
Yeah, and I think common theme that I've seen in my research and in all this is that, well, to Mike's point, if it can happen to Change, it could happen to anyone. But that's very real. If you're not, if you're a mom and pop shop dentist, dental practice, or chiropractor, that doesn't leave you off the target. You're still on their radar for the attack and doing everything you can to protect your practice, your business, and your patients is critical. I'm going to drop a link into the episode description for Rectangle Health's no-cost HIPAA assessment. And additionally, Rectangle Health recently released an extensive blog article outlining the Change Healthcare attack. There's a ton of valuable information in there. So I want to wrap up with the specific action items and takeaways for our listeners. And I'll turn to you both for this, starting with you, Brian. An event like this can happen again at any time, as I just mentioned. And what can providers do to ensure that they're operating at the highest efficiency and are doing everything they can to protect themselves, their businesses, and their patients today, starting right now, immediate action items?
Yeah, first and foremost, let's invest in our cybersecurity measures. That's mission critical, especially at this point. This includes implementing advanced threat detection technologies, regularly updating security protocols, and conducting your risk assessments on an annual basis. Second, we need to foster cybersecurity awareness. I know us at Rectangle Health, we go through a lot of phishing scams and things of that nature. It's tedious, but it helps. It's a step in the right direction. So we need to have that conversation at a FTE level within a provider's office. So those are two immediate actions we can take right now today to mitigate risk. And like Mike said, this is all about risk mitigation at the end of the day.
And Gary, to add to that, there's big vendors in this space, and I would consider Rectangle Health a big vendor in this space. I would consider Epic a big vendor in this space. I would consider Athena a big vendor in this space. Henry Schein in the dental space, and we all need to look at even our risk mitigation to go, well, if I'm I'll use Rectangle, if I'm the payments supplier for, and we're the payment supplier for 60,000 plus practices, right? If my connection to Visa, MasterCard, Discover goes down, well, I better have a secondary connection to Visa, MasterCard, Discover, right? So that as I'm servicing my customers, they don't have that disruption. I haven't built one critical connection to the next endpoint. And as vendors in this space and as partners in this space and providers in this space, right? I think we all need to do that. We all need to look at, and Change is a great example. Everybody had one connection to Change. Well, when it went down and all the providers went, well, can we just send the claims to someone else? No, we only built one connection. Oh man. Okay. Why didn't you build two connections? Why didn't you build three connections? So as we look at sort of partners and providers in the space, we all have to do better for our customers, and our customers are the providers and their customers are ultimately the patients. We all have to do better for them to go, how can we build multiple ways to do these critical business functions? And how can we sort of deleverage some of the critical choke points, right? Or some of the critical, components to make sure that, hey, if something big like this happens, okay, we can, we used to take Main Street. Now you could take, West Main Street instead of Main Street, right? There isn't just one road to get there. So we all have to come together on that. And I think providers have to look and really try to understand some of their critical systems. I'm sure there were plenty of providers that didn't know 100% of their insurance claims flowed through healthcare, right? So they have to ask those questions and they have to push on their vendors. Like I said, even us as a payments vendor, providers should say to us, hey, if something goes wrong in your primary connection, do you have a backup? We absolutely do. We have 9 of them, to tell you the truth. So, if there's something that goes wrong, we can do that. And we have to push on some of these other partners in the space. And Rectangle's partnered with some of these companies. And Rectangle's partnered with a lot of the largest providers in these spaces as well. We have to partner with them to really take a look at some of these critical dependencies and try to risk mitigate some of those as well.
Yeah, thanks for that, Mike. And I think one key note to make is, a provider, a dentist just wants to provide dental care. A doctor just wants to provide the medical care. You don't have to do this alone. I think that's a big important note to mention, that, you take this no-cost HIPAA assessment, you have a conversation with a consultant from Rectangle Health, identify the issues and the gaps and where you may need some additional padding or security or built-in processes and workflows. You don't have to tackle it yourself. You don't have to be an expert. You could rely on, as you mentioned, Mike, Rectangle Health has so many partners. You could partner with someone that is an expert in the industry and can sort of protect your practice, again, your patients, most importantly, and again, your business as well. So thank you so much for that, Mike. It's great insights there. And for our listeners tuning in, if you're interested in discussing options on these solutions with Brian and Mike, I'll have details in the episode description, as well as both Brian and Mike's LinkedIn profiles for you all to connect with and ask any questions you may have. They're a wealth of knowledge, obviously, as you've heard today. And Mike, Brian, again, thank you so much for taking the time to join me today. The insights, the recommendations go a long way in hopefully helping providers navigate these challenging times, be better prepared if it does happen again, and, be vigilant and alert that it could very well happen to them as well. Appreciate you both coming on.
Yeah, Gary, this was great. Thanks for having us.
Yeah, Gary, thanks a lot. We appreciate it.
I just looking forward to speaking again soon and under less tense, better circumstances for sure. For our listeners tuning in, if you found this information helpful and enjoyed the episode, please like, subscribe, leave us feedback in your comments on your favorite streaming channel. We appreciate you listening in, and be on the lookout for more new episodes coming soon on the Modern Practice Podcast. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.